Hi, it's Tom here from Running Physio. Today I want to talk to you about plantar heel pain or plantar fasciopathy, plantar fasciitis, whatever you'd like to call it, and some good exercise options for this, including some considerations for pain, range of movement, and strength. So we're going to cover some ideas, hopefully give you some things that you can take away and use in clinic with people with plantar heel pain. Plantar heel pain. I've also put a link to our other videos that we've got available for you over on Clinical Edge. We've got some great videos there on iliotibial band syndrome, on tendinopathy, on lower back pain in athletes. So do check those out. They're free and available for you to access now. So let's start by talking a bit about plantar heel pain and recognizing that, like many things in kind of physio and sports injuries, it does seem that we focus a lot on exercise as a solution, and I think this is good. But we do need to recognize that this is one where there are other options to consider as well, and perhaps the evidence supporting exercise on its own isn't that strong. So I would think about your other options available here. Perhaps speak to a podiatrist and consider orthoses, perhaps. Think about things like taping if they help to reduce pain. Think about lifestyle changes. We know that weight can be a factor in this as well. So let's not pin all of our hopes on exercise, but it is good to know some of the options that are available to us. Now, I want to start by talking a little bit about pain and what we might be able to do about treating pain. And I want to show you what I think is quite a revealing slide. This is adapted from our Running Repairs Online course. This is from Henrik Ryle's research looking at pain response to different types of exercises for people with plantar heel pain. So we've got three columns here, and up the side we've got the pain score on the visual analog scale. So in the far left column, we've got isometric exercise, which is maintaining a neutral ankle position on the edge of a step, so working the calf to prevent the heel from dropping off the edge of a step. Then we've got isotonic, these were loaded calf raises, and we've got walking, I believe was 4 minutes of barefoot walking. And what they've done here, which they don't do very often in research, is shown each individual's response to these different types of exercise. So we've got their pre and post pain scores. So what you can see if you glance at this is there's a very varied response in terms of pain to these different types of exercises. None of them have a significant, massive pain relieving effect, and each individual seems to have quite a varied response to whether they're using isometric, isotonic, or just simple barefoot walking. Now, in that walking column, I've highlighted for you two examples. So with the yellow arrow, this is someone who prior to doing this walking had a very, very high pain score, nearly 100 on this FAST scale. They've done 4 minutes of barefoot walking, and then suddenly afterwards, their pain score has dropped down to virtually 0. So this is someone having a really pronounced positive response to simple barefoot walking. But the same intervention, we've got this red arrow, someone who started off with a pain score that was quite low, maybe 10 to 15 on this score, and after 4 minutes of barefoot walking, it shot up to around 90. So one of the first points to take from this is that certainly when it comes to pain, but also generally with exercise selection, there is likely to be quite a varied individual response. So it's very hard for us to predict beforehand what exercise is going to ease pain for each individual we see in clinic. So that's where I would tend to go with what we call a test is best approach, something we've talked about in our tricky tendons video series, which again you can access through the link that I shared. And this is this idea that rather than assuming that someone will respond well to an exercise, we reason through what is best, and then we test and see what happens to their pain score before and afterwards, perhaps during a particularly challenging task or provocative task for them. We see if it actually does change or reduce their pain. So when it comes to pain, I think be prepared to listen to the patient first and foremost. What do they tell you helps their pain? Then reason through some options. Yes, you might try isometrics. You may try some isotonic work. You might try simple cardio work or walking. You might use something like doing some gentle rolling of the foot on a bottle of warm water, because that heat can have some pain relieving effects. Or using ice as a frozen bottle underneath the foot, just gently rolling the foot on that. But what it will come down to in terms of pain response is looking at the individual, and it does take a little bit of trial and error and listening to what they tell you, what eases their symptoms, to find what's going to work for them for pain. And this is not a case of, just assuming that everyone's going to do really well with isometrics, which has been the way in the past for tendinopathy and conditions like this. So first point, consider individual response. Try and find one or two exercise options which actually do seem to ease the patient's pain, even if it's just in the short term, to take that edge off it. Second thing we might want to think about is trying to restore range of movement. Now, there is some evidence in the research, although it is a bit mixed, suggesting that loss of ankle dorsiflexion or great toe extension can be a factor in plantar heel pain because it affects how well the plantar fascia is able to function. One of its key functions in runners is the windlass mechanism, where it needs to actually provide tension through the foot to help turn the foot into a rigid lever. And in order to do this, we need to have great toe extension and we need to have ankle dorsiflexion. So as part of your assessment, I would tend to look at ankle range, great toe range, see if there's a clear difference left versus right. And if there is, then we can look to try and address it. And that's where we might bring in something like this. This is from Di Giovanni et al. I believe there's a couple of studies where they've done these plantar fascia specific stretches. Now, if I remember correctly, these tend to be short duration, about 10-second holds, around about 10 reps. And I think they may actually work by helping to restore great toe extension and ankle dorsiflexion range. So I would use these in patients where they are stiff in the big toe or restricted in ankle dorsiflexion, or again, if they find them effective for reducing their pain. Again, we're listening to that individual response, because some people will find, even if they're not restricted, stretching it like this may be helpful for them. Others may find it provocative. So again, it comes down to reasoning and a little bit of trial and error. Also, you might, if ankle dorsiflexion is restricted, want to try a mobilization with movement. And excuse my very skinny ankles here, but this is an MWM, mobilization with movement, you can use to restore ankle dorsiflexion. So you put the foot that has the stiffer ankle up on a step, and you use a nice strong resistance band around the front of the ankle. It's going to sit just below the medial and lateral malleolus, and then you've got it round the leg at the back so that it's pulling from anterior to posterior. It's designed to do a form of AP, anterior to posterior glide on the talus. Now you're going to need a fairly good resistance band in terms of strength to achieve this, but there is some evidence this can help to improve ankle dorsiflexion. Now, being a curious person that I am, I do wonder, is that bit of band enough to change things? Does it actually have a mechanical effect? Is it just that you're getting someone to work into that stiff position? Difficult to know really, but there is a little bit of research to support it. And again, we're going to go with our test is best approach. Show someone how they can measure their ankle range. You can do it using the dorsiflexion app or inclinometer on your phones these days. Get them to do it before they try an exercise like that and repeat it afterwards. And find out what is actually an effective strategy for getting more range of movement for you. So we've had a few thoughts about selecting exercises which might help pain, some to restore ankle dorsiflexion and potentially great toe extension range. Next up, we might want to think about trying to improve movement control. Again, it's all going to come down to your initial assessment. What are you finding? Where do they need to focus their rehab? Are they really struggling with single leg balance on that side? Perhaps they've tried to offload the foot and they've been moving differently, and now they need to work on restoring their balance and confidence there. In which case, I would start with the simple stuff, things like single leg balance, single leg squat movements, perhaps movements they're finding painful or challenging to do, perhaps going up and down stairs might be a factor. And if they're very irritable initially, we would do these in a comfortable pair of shoes or running shoes to cushion the foot, because they might find balancing on a hard floor barefoot is actually quite provocative. And often with control, once we've got those building blocks in place, once we've got single leg balance and single leg squat, we can then take it into more dynamic movements. So start to introduce perhaps some for impact stuff like some squat jumps, and then progress into bounding, hopping, multi-directional work, etc. So for me, that's a kind of pathway really. We start with static control and we can then progress through towards eventually plyometric work and multi-directional control, which can help us restore power. So a few options there, again, very much depending on individual need and assessment. So next up, we might want to think, what about strength? Now, I think particularly in our active patients, those that are sporty, certainly the runners that I love to treat, it is useful to try and assess and address strength, particularly in the calf complex. This is the main shock absorber for the foot and ankle, which we think manages 6 to 8 times body weight. So that might be why options like progressive loading that you might have seen from Rathlither Tools work, where they've got people to do calf raises on the edge of a step with a rolled up towel under the toes and progress from 12 rep max to 8 rep max over 12 weeks. It may be why approaches like this can be effective as part of your management for plantar heel pain. Now, my understanding from this work is that the more active participants tended to get better results. Remember too that plantar heel pain is something we see in sedentary individuals as well. So these may be better suited to people that want to restore the strength through the calf, through the foot and ankle as part of their return to sport. Now, the thinking here with the rolled up towel is it helps to extend across the great toe, which tensions the plantar fascia. And if we do it barefoot, it's likely we're going to get a lot of activity in the toe flexors and intrinsic muscles in the foot and ankle as well. So that can be quite a nice option for some people. Again, need to pick the right patient. It may not be appropriate if they're very irritable. I also quite like things like this, which is a forward lean calf raise. So you're leaning forward with your hands on the wall. So you're starting in a dorsiflex position and then pushing up onto your toes. This is going to be a similar position to toe off during the running gait. And so we're trying to almost replicate that position where we're going to see the windlass mechanism in action. Now, if we're going to do these with someone, I will encourage them to try and go through the big toe. So on this image, hopefully you can see that I'm actually managing to get that forward lean calf raise by pushing through the great toe on my right foot. That looks quite different to this, where you can see the angle of the foot and ankle is quite different. Now I'm going through the lesser toes, the outside of my foot, which sometimes is called low gear propulsion. So I'm not really going to be loading up the plantar fascia, mobilizing the big toe if I'm using this technique. So if we're going to use these calf raise options, I will often try and look at the technique side of things and see, can we get people using that great toe, loading the plantar fascia, utilizing that windlass mechanism whilst also strengthening up the foot and ankle. Now, there's been some research into plantar heel pain, looking at some of the deficits you may see in people with plantar heel pain. And there's some evidence to show that there may be ankle everter weakness. Remember, the ankle everters, some of them help to plantar flex the first ray. They may also be toe flexor weakness. So I think it's sensible to do a thorough assessment of the strength around the foot and ankle at the start. Look at calf strength, look at inversion and eversion strength, have a look at toe flexor strength, and then you can try and include some exercises to address those individual specific needs. And I don't think it needs to be complex. We can go with resistance band work to strengthen up the inverters and everters if you want to. We'd expect that our barefoot calf raise is going to get the toe flexors working, but you might choose to do some isometric toe flexor work or some banded toe flexor work potentially, or even simple things like toe scrunches on towels, whatever you feel is going to be appropriate for the patient and their level. But hopefully we can develop a nice strong foot and ankle to help them manage the forces that they're going to need to manage in their sport, potentially in running. So we've had a few thoughts here around pain, around range of movement, around strength and control. I do think it's worth considering the options in terms of fitness and cardiovascular exercise, particularly as we said, in some patients they may be quite sedentary, and actually we've found there's a connection between plantar heel pain and BMI. So it is something that's associated with obesity potentially. So for some patients it may be more appropriate to pick exercises to help them with their general health as part of a more broader strategy, perhaps to help them with their weight if that's part of the picture for them. So again, we want to think what's going to be the best option for them. Similarly, if you've got an athlete that wants to cross-train whilst they can't run or their running is less, we want to think about the options that are going to be best. And generally, there's several that have got a very low load on the plantar fascia. So this would include most swimming strokes, things like rowing, but also cycling. Particularly if you get someone to set up their bike so that the pedal is under the center of the foot, so they're not pushing down repeatedly into dorsiflexion if they're placing their toes on the pedal. So you might look at cleat position there potentially. But again, we want to be guided by pain response. But this might allow us to get some cardiovascular exercise in there to improve fitness and general health. We know too that we're likely to get a pain relief response in some people from cardiovascular exercise too. So that can come with lots of benefits for us in terms of our fitness, perhaps in terms of pain, maybe in terms of mental well-being as well. Okay, so that's a quick overview of some of the exercise options available to you for plantar heel pain. Certainly not all, there's lots more out there. Perhaps you've got some ideas. Please do share them in replies and comments. Are there any big ones that I've missed that you think that we should bring into clinic for people with plantar heel pain? What do you think about the rest of the leg? We focused mainly around the foot and ankle. Do you think we should be focusing higher up or on any muscle groups or anything? Let us know in the replies and comments. And of course, let us know any questions you have about this. And if you'd like to learn more about running injury, do check out our free videos over on Clinical Edge. I've put a link in there for you. We've got lots of crackers there to help you get great results with runners you see in clinic. Okay, thanks again for listening. Bye for now.